Unions representing healthcare workers are calling for further investigations into Netcare's Kingsway hospital in Amanzimtoti after a patient tested positive for COVID-19. No new patients are being admitted to the KwaZulu-Natal facility in the wake of that infection. Several staff and other patients have also been isolated or told to self-quarantine until their results come back. It's the second such incident in the province after 66 people tested positive at Netcare's St. Augustine's Hospital. Our reporter Karinda Jagmohan has this update.
Yes, we understand that investigation will now get underway into the Netcare Kingsway Hospital. This is the second investigation into a Netcare-owned private hospital here in KZN. We saw the first investigation at the St. Augustine's Hospital in the Durban CBD. Now this investigation will be combined with the Kingsway report. Just going further, unions are calling for the investigations to be expedited for the protection of our healthcare workers. I'm joined by Nehawu's Ayanda Zulu. Mr. Zulu, thank you for speaking to Newsroom Africa. Tell us about your meeting thus far with management and your calls for the investigation to be fast-tracked.
Thank you very much. We just had a meeting with management and there is no new information. I think we have saw the statement by Netcare. There's no new information. It's almost the same like a statement that was released by the CEO of Netcare in relation to St. Augustine's. We think that the private health care center is prioritizing the maximization of profit as well as their reputation more than the lives and the safety of our members. So we are concerned. Last week, on the 3rd of April, we wrote a letter to the Department of Health to say the Department of Health in the province must exert its authority over these private hospitals because we think that there is a non-compliance that is taking place here. How do you explain the incident of St. Augustine's? And according to the reports that we have just received from our members on the ground, there are more than 40 workers so far that have been tested. And the unconfirmed reports from our members here is that there is a significant number that have tested positive. And we think that the employer, under these circumstances, have got no remorse, is more concerned about the reputation. So as Nehawu, we are calling for the investigation again. We have called for the investigation at the issue of St. Augustine's, and the department we are concerned about the department. We think that they are believing the authorities of this private hospital more than the information that we are giving them. And from our own reporters at St. Augustine's, there's a clear indication of negligence on the side of management and the lack of PPEs, the non-provision of PPEs, and also the issue of training. We can see that the staff have not been trained in terms of the usage of the PPE as well as on how to deal with the patients that have got COVID-19.
Going forward, Mr. Zulu, do you think that our hospitals, whether public or private, will be able to handle the pressure of this pandemic? Like we heard from Professor Karim, we do expect the number of cases to increase.
We're extremely worried. Look, there are no admissions now at St. Augustine's. There will be no admissions at Kingsway. All patients now are now expected to be reporting largely in public hospital. We remember we have been making a call for some years now to say the public health department must employ more doctors, more nurses, more health professionals and workers, and the department have not been doing that. Last week we thought it was fake news, the MEC calling for people to do a voluntary work, and we think that the department might not have that particular capacity. More especially, remember when there were reports in China and other countries that this pandemic is moving very, very fast, and the South African government assured us that they are more than ready. But the incidents and on how they have unfolded in the past weeks there's an indication that we're not ready as far as the provision of PPEs is concerned, as far as training of workers is concerned, also as far as the infrastructure is concerned.
Well, thank you very much, Mr. Ayanda Zulu. He's from Nehawu here in KZN, speaking about the concerns with regards to healthcare workers, but also very serious allegations against the Netcare-owned hospitals, just as how the Netcare in their statements to the media have said that they are taking all necessary precautions to ensure mitigation of transmission of COVID-19. They've closed parts of this hospital, sections of this hospital rather, are being closed, and there are no new patients being admitted. We understand some patients will be moved from here to other facilities. With regards to PPE, they have denied the allegation that there is no PPE for their health workers. They also have said that they have trained their staff, but going forward, of course, we need to look into this report and the investigations that will be stemming out from now 2 hospitals in KZN where we are seeing transmissions of the coronavirus. For Newsroom Africa on Channel 405, I'm Karinda Jagmohan in Amanzimtoti, KwaZulu-Natal.